This is where I come from. This is King Faisal Specialist Hospital and Research Center, which is the largest tertiary care referral center in the region, where we have almost 1,000 beds. We have active organ transplantation center, oncology center, etc. But we believe in the role of nutrition in managing these patients on a daily basis. I want to stress on a fact that breast milk is for humans. It was stressed earlier. It is not only the best, it is just created to be fed for human babies. And this study from southern region of Saudi Arabia, the number of the percentage of mothers who are exclusively breastfeeding at 6 months of age was around 8.3%, which is extremely low in our community. This is among school teachers. So it's very low, and we have a role as pediatrician to improve the practice of breastfeeding. So camel milk is for camels, cow milk is for cows, horse milk is for horses, elephant milk for elephants, and giraffe milk for. So breastfeeding is the golden standard for optimal nutrition and health and disease during infancy, and even during toddlership. These are the composition and functionality of the human milk components. As you can see, we have lactose for energy, protein for growth and immunity, prebiotic, which was mentioned earlier, for microbiota, immunity and gut health, and fat, and mainly LCPUFA for energy and brain development as well as immunity. And on the other side, we have functional components, including immunological compounds like IgA and lactoferrin and LCPUFA and HA and others. This is a simple cartoon. Maybe those who do not speak Arabic, I will translate it. This is a mother coming to the clinic. This is a healthcare professional. She asked the mother, do you know what is the difference between breastfeeding and artificial feeding? So she did not mention, LCPUFA, prebiotic, whatever. She said, yes, breastfeeding is free. So you don't pay for that. So this is a very simple, approach for, supporting breastfeeding, but it also gives you an idea about, how does people look to breastfeeding. So they think that just breastfeeding is free. If you pay for something, it will be more valuable. Why don't we try bottle feeding? Let us talk about the brain. The brain is still a mystery. So we have different people in this hall with different brain sizes, different brain functionality, and how do they function. What is the brain weight at birth? Anybody knows? 1/3 of the adult. Any estimate? Other estimate in grams? 300? 300. Okay, let us see. So if you see, at 20 weeks of gestation, it is 100 grams. And at birth, it is 400 grams. So 100 and 400, the difference is what? 300 grams. So there is a tremendous growth of brain in the second part of pregnancy. And especially in the third trimester, the brain grows very fast. And when you go, an adult brain is like 1,400 grams only. So to take it simple, the newborn brain is around 333 grams to 400, and the 2 years old is 999. So it has tripled. So we have a very rapid growth during the last trimester during pregnancy, as well as in the first 2 years of life, which is very important for the development of the brain of these infants and their functions of the brain. So the brain is the most complex 3 pounds in the universe. It has 100 billion neurons at birth. And every minute, there is 1/4 to 500,000 neurons during some stage of development. And they say the neurons that fire together wire together. And this is very important in general. If you see the major areas of the brain, as you know, the frontal, lobe, which is important for self-regulation, problem solving, goal setting, social cognition, and the occipital lobe for vision and perception, parietal lobe for sensory motor perception, spatial abilities, and the temporal lobe for hearing, language, memory, social, and emotional function. So every part of the brain has a different role. Maternal nutrition was discussed earlier, and it is very important as the mother is the source of nutrition to the baby. If the mother has a good source of nutrition during pregnancy, she will supply the LCPUFA to the infant, which is very important for their growth. And also the placenta has a selective role in taking up the LCPUFAs from the mother to the infant. And that's why in subsequent pregnancies, mothers should have enough supply of LCPUFA through their diet to maintain a good level of LCPUFA to their subsequent pregnancies. So the health of the mother is very important. It gives good health to their baby. As was mentioned earlier, breastfeeding, breast milk it's different from one mother to another. So if a mother has a good diet, balanced diet, she will have a good product in her pregnancies. Let us come to the LCPUFAs, which are polyunsaturated, long-chain polyunsaturated fatty acids, mainly omega-6 and omega-3. There are important, fatty acids. In the omega-6, we have the arachidonic acid. And in the omega-3, we have 5-alpha-alonic acid, which is from animal plant, from plants. And we have the eicosapentaenoic benta-ionic acid, as well as docosahexaenionic acid, which are constitute the major omega-3 fatty acids. As you know, at birth, the other fatty acids plateau, and the DHA will double very quickly as the baby is born, which is very important for development of brain. So what is the role of nutrition in brain development? Nutrition affects both the structure and function of the central nervous system during critical periods of development. Macrostructures, cerebellum, hippocampus, frontal lobes. Microstructures, cones, dendrites, and synapses. And neurotransmission speed, which is extremely important, especially myelination and the neurotransmitter function. So there is a rapid brain growth between 20th week of gestation and 2 years of life. And the brain size increased by 64% at 3 months of age. So this is very critical period also. And nutrition is crucial to the initial development of the central nervous system and then to the maintenance. What is the role of DHA, docosahexaenionic acid, in development of CNS? 7.2% of fat in the cortex is DHA. 15% in the frontal cortex is DHA. So it has a role in neuronal membrane structure and fluidity, which is very important for the cell membrane function. It has a role in the number of transmitter receptors and production of neurotransmitters and brain peptide, as well as the speed of the neurotransmission. So the DHA is very important also in learning and cognition, depending on a large amount of DHA accumulation in the brain during the critical period of development. And there are potential long-lasting effects of LCPUFAs on learning and cognition beyond the critical period of development. How do we measure, cognitive development in infants? It's maybe difficult in daily life, but we usually measure intelligent quotient and development quotients, and we can have different scores which are derived from standardized tests. Let us see, most children have IQ, this is the IQ, between 85 and 115, the majority. However, I'm sure we are here in the hall, we have people who are exceeded 115, as an IQ. So this is very important to have a standard for infants when we measure their intelligent quotients. I have, struggled with this Bailey scale during my board examination. So all questions is very difficult to answer, So this is a scale which is a standard scale. Well, it will detect the developmental delay and for infants. In 1993, the second edition was concentrating on mental development index and psychomotor development index. Recently, in 2006, the scale 3 has developed in 5 scales, including cognitive, language, and motor scale. And also this Whistler Preschool Primary Intelligence Scale, which has been established by David Whistler in 1967. It has 14 subsets which check different part of abilities in these infants, and it will check the verbal IQ, performance IQ, and the full scale IQ. These are important when we come to the test done on babies who are fed with LCPUFA. And we have specific tests for cognitive development, including problem solving, rate of learning, speed of processing, memory, attention, etc. This is a camel, which we commonly see in Saudi Arabia. This is my daughter. She took this photo during one trip to Dammam in the desert of central area. We don't consume a lot of fish. We eat a lot of camel. So that's why we have problems with LCPUFA in our area. So what is the scientific evidence of LCPUFA in infant development? So in many different areas, there is evidence, including visual acuity, learning, speed of processing, attention control, problem solving, etc. And LCPUFA is very important in visual acuity. It contains almost 50% of the fat in the retina. And infants can be checked for visual acuity by 2 ways. Number 1 is the forced choice preferential looking, which is called Teller acuity cards, and this is usually used by ophthalmologists. And visual evoked potential, where they can test this baby. And acuity improves rapidly from birth to 4 months and continue until adult-like level reach at 5 years. You see, this is a baby at a newborn where he looks to his mother, and this is the same look at 4 months of age. So visual acuity improves dramatically. Let us see about adult visual acuity. What do you see? Nothing? So this is an old man. Maybe this is myself with white beard in 20 years from now. But when you have a closer look, you see something different. So what you look initially may not be a reality, and you may see something different. So this can show you, a horse, a man, a river, a gate, etc. So visual acuity is very important for infants' development, and if they have good, supply of LCPUFA, then the visual acuity will improve. And this is showing the effects of DHA and RA in formula in regard to visual acuity, comparing patients at 2 months between infants who are fed with LCPUFA and who are not supplemented, and it favors those who has consumed LCPUFA. So in problem solving, infants who received DHA and RNA who showed poorer attention control at 3 months, at 9 months they solved more two-step problems at 9 months than the control group. And there are 2 separate randomly controlled trials showed that infant fed the formula with DHA and ARA had better two-step problem solving at 9 months compared to control group. And also infant fed a formula with DHA and ARA solved more 3-step problem at 10 months than the control groups. And this is the complex 3-step problem. So the baby will remove the block, then they pull the clothes, and then they lift the cover and find the toy. And if they are supplied with LCPUFA, it has been shown to improve the 3-step solving. And they have poorer problem solving with the control group. I don't think there is a video, it is not working. Let us see the diamond study, which is the DHA intake and this is nutritional deficiency. I forget the abbreviation, but this is used in term infants. They were divided into 4 groups: a group with no supply, which is the control group; a group with fixed amount of ARA and changing amount of DHA, 0.32%, 0.64%, and 0.96%. And they checked their visual attention at 4, 6, 9 months, and heart rate measured to identify phases of attention. And this is what was the result. Those who have 0.32% and 0.6%, they have increased sustained attention. This sustained attention is a way to test the ability of the child to concentrate on a subject for some time. And those who have more LCPUFA has better sustained attention. So the supplementation of the formula with LCPUFA in children aged 6 years with the DHA and ARA in infancy were more efficient at solving problems. And in the diamond study, children followed up between 18 months and 6 years compared to the control group. The LCPUFA group has better scores on attention, control, receptive vocabulary, and Whistler full scale and verbal IQ scale, as well as executive function measures at 3.5, 4, and 5 years of age. It has shown excellent effect of supplemented children with LCPUFA. This is the dimensional chain card sort, where they test the child ability to look for the shape. They give them cards and they put it in the cartoon which contains the shape, and they switch to the color and see their ability to recognize that. So first, shape game. So the infant should put the car in the car here, and the rabbit in the rabbit here. But once they switch color games, most patients who has poor LCPUFA supplementation, they failed to change the color accordingly. And this has shown that children with poorer attention control make errors after the rule has changed. And this is shown also in this graph, where you see those who were given 0.32% DHA and 0.64%, they did the best. This is a camel. It's not in the desert. So where is this? Anybody knows? Huh? in the mountain. You know, camels, they don't live in mountains, so they live in the desert. So this is a camel in Saudi Arabia. So we see camels now in the snow. So for the last 3 years, we have snow in Saudi Arabia, and this is a camel in Tabuk area, which is close to the Jordanian border. And we are seeing, you know, so it's very interesting. I could not believe myself to see a camel with a snow. What are the recommendation and conclusion? This is, you know, the recommendation from different society. The joint FAO, WHO expert consultation on fats and fatty acid, they recommended, you know, up to 6 months of age, DHA of 0.2 to 0.36%, and ARA 0.4 to 0.6%, and older than 6 months up to 24 months, 10 to 12 milligram per kg of DHA. The European Food Safety Authority in 2014, up to 6 months, 0.3% of DHA to 0.49%, and you know, there is one missing. I don't think the slide is not available. So these are the recommendations for DHA and ARA in infants and toddlers. So the available evidence strongly support the benefit of adding DHA and ARA to infant formula, and DHA should continue in children's diet beyond the 2nd year of life. DHA must be deposited in adequate amounts in brain and other tissues during fetal and early postnatal life. Pregnant and lactating women should aim to achieve a dietary DHA intake of at least 200 milligrams per day. And it is very important, you know, mothers, if they don't have enough supply of DHA, their babies will be deficient and will affect their, you know, cognitive growth and their brain growth. And even, you know, it is recommended that pregnant lady should take at least 2 portions of fish per week, which is equivalent to 200 milligrams per day. So, and there are good fish and there are bad fish. So the good fish that does not contain mercury, because if they take bad fish which contains high amount of mercury, it may affect, you know, their babies. So the good fish is salmon, tuna, and cod, and others. So achievement of cognitive, social, motor, and communication milestones can be checked during the 1st year of life by different scales. And cognitive, social, motor, and communication development depends on the development of the brain. LCPUFA may play a fundamental role in brain development and function. The different trials show positive effect of LCPUFA, especially DHA, on development in infancy. And the new data include the long-term benefit of early LCPUFA supplementation for cognition in later childhood. Optimal nutrition in both mothers and infants promotes optimal brain and cognitive development. I hope you are concentrating like this baby at the end. And this is myself in our farm. I missed this weekend in very beautiful palms and, you know, good weather these days in Riyadh.